viewers, welcome to a special edition of Women's Stories. Today we have a special guest following the video that we did last time about diabetes. A lot of people approached me via Facebook and even on the YouTube video talking about diabetes, saying they are diabetic. And I think one of my major concerns was the number of young people who came into my inbox and say they're also diabetic. So we decided we would bring an expert in this field, Setfree Nherera Mafukidze. Thank you for coming to the show. Can you introduce yourself to our viewers?
All right, thank you so much, Beatrice. Thank you, viewers, for watching this important video. My name is Setfree Nherera Mafukidze, as you have been told already. I'm a nurse by profession, and I started out my nursing profession in Zimbabwe, and over the years, then decided to move out of Zimbabwe to the United Kingdom. But my background in diabetes care did not start in the United Kingdom. It basically started in Zimbabwe. For starters, my own mother, she succumbed to diabetes. She was type 1 diabetic. She normally would administer, insulin for herself and everything. And this is one of the first experiences I've had with diabetes, because it was just too close to home. And, seeing my mother going through that and eventually dying of diabetes, as I grew older and as I went into healthcare myself, I thought I should also pursue, a specialty in diabetes care, so that we can help quite a number of people understand what diabetes is all about. I would say during the time people like my own mother suffered from diabetes, there wasn't enough awareness on diabetes matters. There wasn't enough education to impart to patients on how best they can manage their conditions from their various homes or anything. It was definitely well managed in hospitals, but going back into the community was always a difficulty for many people. Now, during my early stages of my career, I had the experience of working with organizations that were looking mainly into how to combat non-communicable diseases. Diabetes is one of the non-communicable diseases, as well as hypertension, asthma, and all the other non-communicable diseases. So I then went on over the years to also work with an organization that was looking more into COVID issues. When COVID-19 hit the world, so as I was interacting and visiting patients and checking up on patients, I then discovered that most of our patients who were diagnosed of COVID-19, they also presented with diabetic symptoms. So I started, I asked my boss, who was my medical director, if I could at least check all these patients whom I was visiting in their homes, if I could check their blood sugar levels, collect bloods, so that they could also be checked if they are not diabetic. And then it so happens that quite a number of patients that I visited in their houses actually turned out to be diabetic. That is, after they had contracted COVID. Some of them didn't even have a family background of diabetes. But in the end, we then discovered that some of the patients had become diabetic after contracting COVID-19. So when I then left Zimbabwe and came to the United Kingdom, I saw an opportunity to explore diabetes care deeper and further. And I made quite a number of inquiries with the diabetes team in the hospital that I was working at. They gave me guidelines and said, okay, if you are new to this, you need to go through some competencies, which I did. I did quite a lot of competencies with the Cambridge Diabetes Education Program.
Okay.
That program is an open program, and I would encourage anyone who would like to, gain insights from their homes. If they want to do this program, they can also do it. It's bite-sized, and you have to go through various topics which are covering all aspects of diabetes care and all types of diabetes. It's a very important program because it gives you a whole lot of education in the area. It doesn't miss anything. It covers almost everything that you normally would have as a question to say, okay, what do I do when I'm in this situation? How do I manage my insulin? How do I do this and that? It's very broad and covers all that. So after I did that, I then, wanted to expand further. I then got involved with the International Diabetes Federation.
Okay.
And I did quite a number of professional courses with them in diabetes education and all sorts of things. There's a lot to do. I'm still doing a lot with them.
Okay.
And in the process of doing that, I was also using my social media platforms to spread awareness where diabetes is concerned. And as a result, there was a large number of people reaching out to me from Zimbabwe, particularly, to say, okay, we are struggling with this condition. My father is struggling. My mother is struggling. And I've taken my time to guide, most of these individuals and try and, talk to their parents on how to best manage the condition and how to live better with diabetes. I must say, in some of the cases and most of the cases, we've been very successful with all these people that I've been talking to. We've been successful, and they are managing much, much better now than they were before. Because I think this is attributable to the fact that in Zimbabwe, this diabetes does not have, like huge coverage in terms of education and awareness, like I said earlier. And that is an area that we should all be concerned about. Why should we be concerned? It's because diabetes is going to be one of the biggest problems in the world by 2045, if I'm not wrong. 2045, according to the International Diabetes Federation. And they say we'll probably have around 800 million people with diabetes by that year.
That's a huge number. If I could just stop you there. One of the things that a lot of people who inbox me were saying is, I didn't know, just like in my case, had I not fallen pregnant, I wouldn't have known that I was diabetic. So I found that to be very interesting, like how many people are walking around and they're diabetic and they don't know.
Yeah. So you definitely have a lot of people walking around and not knowing because they haven't come across the information. And people, they are the biggest problem. One of the biggest challenges is, as people, we don't like reading, we don't like searching for information. But I always encourage people, when you feel funny, when you have funny symptoms that are, something that is new happening around you, you need to at least search for it. Just try to find out, just to have a basic understanding of what exactly has changed within your body. This information is available online to those people who want to get this information. It's definitely available online. You check that, then you also check with your doctor or your GP to establish what exactly is changing with me. Because, for example, when we talk about diabetes, the signs of diabetes are very noticeable if you are someone who is willing to notice. Because
maybe let's quickly jump into what are the signs, because like in my case, I never experienced anything. The only thing is I would wake up in the mornings feeling very tired. So I'll just call myself like not a morning person. Other than that, there's nothing that I had observed. So what are some of the things to look out for?
So First, I will address your case. That is gestational diabetes. That's how you started out, because you found out you were diabetic when you were pregnant, isn't it?
Yes.
So that's how it normally would start. You would have these symptoms of fatigue and frequent urination. You feel very hungry. Those are some of the symptoms of diabetes, as well as maybe blurred vision in some cases. A lot of people get a number of cases of blurred vision. But now, I want to address you specifically because I understand you type 1 diabetic, isn't it?
Yes, I am.
Now, let's explain the two main types of diabetes. Two main types of diabetes. We have type 1 diabetes. What is happening in type 1 diabetes is your body does not produce a hormone called insulin. Insulin is what is necessary to control blood glucose levels.
Okay.
So when you are type 1, you do not have that insulin produced in your body. Your pancreas is the organ responsible for producing insulin. So over the years, you were not diabetic over the years.
Okay.
But if you go to the basic explanation of saying what is type 1 diabetes is normally a chronic condition where you cannot, where blood glucose levels are not controlled because there is no insulin, absolutely no insulin. However, for a person like you who got this diagnosis at a later stage, that will be what we call latent autoimmune diabetes in adults.
Okay.
Okay. Yes, because normally the onset of type 1 diabetes happens at a very, very young age.
Okay.
You will find, very young people will come up with such diagnoses. Now, it rarely happens in older people. But what will be happening in older people is there is an attack on the pancreas within the body. So when that attack happens, the pancreas stops producing insulin.
All right. Tell me like I'm a 5-year-old. So this attack could be caused by things like drinking a lot of alcohol?
Not exactly. I wouldn't want to attribute that to drinking a lot of alcohol. Some of these things are genetic,
Okay.
If you trace back within your family, you probably have someone who was diabetic.
My parents and my grandparents are diabetic.
Yes, so some of these things are also genetic. Though alcohol consumption and all these lifestyle choices also then come and play a part. But in type 1, it's mostly genetic.
Okay.
And you would find more of the lifestyle factors affecting people who are type 2 diabetic. Because in type 2 diabetes, your pancreas will produce insulin, but the insulin that your pancreas produces is not sufficient to control your blood sugar levels. This is where we then introduce medications that try and help get rid of excess blood glucose from your blood. You see, most people who are type 2 diabetic will be told you're starting on metformin. This is the tablet that you're going to be taking. What metformin simply does is it gets in there and it then works in between the liver and the kidneys, managing the excretion of excess glucose from your body. So that is where the difference is. When you're talking about type 1, there is absolutely nothing you could have done about it. But with type 2, you can actually delay onset of type 2 diabetes, or even prevent it from occurring totally in some cases. So when we look at type 2 diabetes, we're looking at lifestyle choices. What is it that we are doing that could have led to a quick diagnosis of diabetes? We are probably excessively drinking. We are probably not physically active, we're probably, obese, we're eating beyond what our bodies can manage, and that then presents with a problem. And then you are also smoking, those are the factors that could also lead to type 2 diabetes.
Okay. So we are still at Women's Stories talking about diabetes. Now, I want to find out, how does it specifically affect women? Because this channel, we mostly talk about women. And are there any things that, are different in terms of how it affects women? Or that you want to highlight so that women are aware?
Well, you see, when I talk about diabetes, I want to talk about it from an African perspective. If you are talking about women, then I'll address the African woman.
Okay.
Because you must understand that the whole world over, diabetes affects mostly Black people and Asians. Okay. Why do you think it's like that? It's like that because of our eating culture. We also have an eating culture that is, that is carbohydrate based. And if you go to any party right now, if Beatrice is hosting a party right now, when we get to the table, we're probably going to see a lot of salads are there. We're going to see rice. We're going to see potatoes as well. Okay. So all these foods, they've got an impact on what we call glycemic index. So the glycemic index is basically a scale of, trying to read into what type of foods would really, give you a blood glucose spike quickly. So this is the eating culture that we have in Africa. It's not very good. And the culture of exercise, physical activity in Africa, it's not very good. Now, for women, the other challenge would be, remember, insulin is a hormone, right? And you should understand that women have a lot of hormonal activity going on. I mean, more than men, if I may say. And with that hormonal activity, there is a lot of interaction at play with those hormones, with your insulin and all the other hormones involved in women. Now, the only way to manage your diabetes as a woman is to also stay active. Gone are the days where you let men fill up the gyms and let men do most of these things. Women all equally need to be involved in activity. That will also help in trying to control their blood glucose levels and increase insulin sensitivity. So for women, I would really encourage you to, take part in all sorts of exercise. And this habit of deep thoughts, women go deep into thoughts with things. And one of the most I would say one of the issues affecting women the most will be depression. Just merely getting the diagnosis to say, okay, you are diabetic, depression immediately kicks in. It doesn't affect women only, though I think it affects women more than men. The most interesting thing that you have done, Beatrice, is to have this platform where you openly discuss about diabetes and how you are treating yourself as you go. That is very important, because it opens up the world to see that they are not alone. There are a lot of other people who are also, dealing with this condition on a day-to-day basis. There is that importance of creating groups. If you are women and okay, we are 10 women who are diabetic, create a group, create that kind of interaction where you talk about your condition, how best to manage your condition and everything. That is what is very important. Unfortunately, I could not really break down, issues specifically to women like you asked, but I generally address diabetes in the sense of everyone who has diabetes I haven't really like specialized specifically on women issues, but I know what I've stated so far is what I know mainly affects women in that area.
Okay. Thank you very much. Because from my experience, like in the last video, I talked about thrush, that I would have bouts of thrush maybe 4 times a year. So it's only when I went, for diabetes management and care, that's when I was told, oh, it's also common in women who are diabetic to have thrush.
Yeah, I have a small list that I've written down here. I think it was one of the issues I was going to talk about, but to totally say it only affects women is probably not correct. But women, women get these things exposed maybe faster or the men because of their anatomy and everything. But it's one of the issues that affects women, like you said. You're very right there. And there are also issues to do with I think let me just get into this and then address issues to do like to think when you're dealing with the sexual reproductive system. It's a matter of when you have diabetes, you become prone to a lot of infections. And because there isn't an understanding of these issues, we have seen some of these issues get directly into your marriages and affecting your marriages because there's no general understanding. So when you're dealing with conditions like diabetes, it's important for your partners, your husbands, to be involved, know about this, and to know what could happen if one is diabetic, right? Because when these situations then arise, you now have a situation where someone starts saying, no, there's something that is happening here. I don't understand why we have this kind of situation. Why do we have candida affecting us and stuff like that? It's all because diabetes exposes you to high risk of infection. When you get an infection and you're diabetic at the same time, it's often very difficult to manage. Now, while we're addressing this in general, we would then also want to address things like foot care. Right. When you are diabetic, you are certainly discouraged from, moving around the house without shoes on. Even when you're in the house, always always put on a pair of shoes. Um, you you need to stop sandals totally. Your shoes really have to be closed. They really have to be closed because diabetes has got a number of complications, Beatrice. One of its complications is neuropathy. In neuropathy, we are saying the nerves, your nerves in your lower limbs, they're no longer as responsive. They don't respond to pain anymore in some cases. And then if you get injured in one of your feet and there's a wound there, it is very difficult to treat a diabetic foot ulcer.
Okay, I'm going